to allow people to join in as they come in. But first, I just wanted to say thank you all so much for joining us on this Pulse briefing on our 2023 findings for Native American and Indigenous respondents. My name is Austin Montoya, and I am a Senior Officer for Policy Advocacy Communications here at the Colorado Health Foundation. We've been working on the Pulse poll all year, and I'm really excited to share with you all our findings from Native American respondents. A few housekeeping items. This meeting is going to be recorded, and I will make sure to send out this recording as well as additional materials after the briefing. And I'm going to go through the slides fairly quickly. There is a lot to cover. Everything that I talk about today certainly is not all of the data. And you'll have the opportunity to discuss your thoughts, any comments you may have, and also there will be a Q&A session at the end. Real fast, I just want to give a shout out to my fellow CHFers on this call, as well as folks from our Health Foundation Native and Indigenous Affinity Group. Some folks you may know, some you may not, but I hope that this is a great chance for some good connections as well as some good discussion. So with that, I am going to go ahead and just dive in. So a little bit about the Colorado Health Foundation. So our goal is to bring health and reach for all Coloradans. And our vision is that across Colorado, each of us are able to say that we all have what we need in order to live healthy lives. And we do that really by engaging closely with communities across the state through grant making, policy advocacy, and research. Advocating for change and really listening to Coloradans across the state. So a little bit about Pulse, if you don't already know. Pulse is an annual poll that really takes, no pun intended, the pulse of Coloradans on a range of issues impacting their health and well-being. So really, it's about listening. It's about hearing from people outside of our own circles and really gaining a greater understanding of how Coloradans are navigating today's challenges. As a part of our commitment at the Foundation to racial justice, we do this by oversampling particular racial and ethnic groups, including African Americans, Asian Americans, and Native Americans. So the really cool thing about Pulse is that with our Native American respondents, we're able to partner with a lot of you folks on the call today. And we really wouldn't be able to get a lot of the data on Native respondents without a lot of our partners. So you see a lot of them listed here. But really, the reason that we oversample these Coloradans of color is really so that we can explore kind of the issues, communities of colors, about what they're experiencing, about things that are impacting their health and well-being, and that we're able to analyze every single question by race and ethnicity, and we make all of this data completely available to the public. Since Native Americans living in Colorado really make up less than 2% of the population, it's difficult to achieve a large sample size through our probability sampling methods. So in order to increase that size, like I said, we partner with a lot of organizations across the state so that we're able to get a better sense of what Native and Indigenous respondents are experiencing on a lot of these issues. So what does Pulse cover? Lots of topics include affordable housing, hunger and food insecurity, economic opportunity, racial equity, gun violence and community safety, financial security and the economy, healthcare access, and mental health and substance use as well. So a few things that I want you all, while you're listening to some of the data, to reflect on a few of these questions. And we'll have an opportunity to kind of talk through some of these things at the end. But really, because we partner with Native organizations and community leaders, we have been able to achieve a good sample size, but we know that we want to do more. So think about how can we at CHF and at Pulse really improve our outreach so that this data better reflects the diversity of Native folks in Colorado. How can we work with you to make this data more useful for you, for your organization, and for your community? And how would you like to be engaged as we prepare for Pulse 2024? So a little bit about our methodology. Pulse was conducted between April 8th and May 3rd of this year. We use a bipartisan polling team. So FM3 Research represents folks, an organization that generally does polling for Democrats. And then we work with Newbridge Strategy that usually works with Republicans. Just a little side note, we do interview folks regardless of their political affiliation, but we do ask about that as well. And we do this polling through phone and online surveys. And through that, we interviewed overall a little over 2,600 Coloradans. And we reach out to folks to get them to fill out the survey through calling them, through email, and through text invitations. And that the poll is conducted in both English and Spanish. This is a little bit about how we break up the state. Now we know that, across the state that these are not necessarily all, not everybody that lives in these particular geographic locations all have the same feelings, but we do want to be able to separate our information and our data up by geography. So we do break it up through the Eastern Plains, through El Paso and Pueblo County, Larimer and Weld County. We have the Denver Metro, and we have the Western Slope. Now, I said that we interviewed a little over 2,600 Coloradans across the state. When it comes to Native and Indigenous responses, we were able to achieve 170 responses from folks who identify as Native American or Indigenous. And the majority of that came from our convenience sample. So when I say convenience sample, rather than our random probability where we reach out to people randomly, this is where our partnerships with Native American organizations and serving organizations and community leaders really is important. We're able to have these folks reach out to their networks, reach out to their communities in order for them to fill out the survey. Now, the convenience sample and the random sample have the exact same questions, so nothing has changed. And you'll see with some of the materials that I'll be sending out after this, that you will be able to see that all of those responses, while you'll see that there's a kind of an N of 43, that just has to deal with the weighting of the data to make sure that everybody is representative of the population as a whole. So digging into the data a little bit more, we do break down by geography. Majority of the Native and Indigenous respondents did come from the Denver metro area, about 65%. You'll see that Pueblo is below that at 16%. But we were able to get a fairly good representative sample versus of male versus female. We also asked people about whether they have children. So majority of folks either had no children or had children that were 19 years or older. We ask about their age ranges. So we have about 37% were 18 to 29, 22% were 40 to 49, and just so on. We also ask about their level of income. So you'll see that 27% said that they make less than $20,000 a year, 15% 20 to 50,000, 13 50 to 75, and so on. We also ask about their political affiliation. So 24% of Native American and Indigenous respondents said that they were Democrats. 42% said that they were unaffiliated, and 14% also said either they don't know or they refuse to answer. So I'm going to go in on kind of the top concerns of Coloradans as a whole first, just so you get kind of a better sense of where we're kind of coming from. We've asked a lot of these questions year after year, so you are able to dig into the data and see how these things have kind of changed. But the next few slides are going to be how Coloradans across the state, regardless of racial or ethnicity, answered. So you'll see that the rising cost of living, the cost of housing, and homelessness really topped was at the top of folks' concern. 85% said that the cost of living was either an extremely serious or very serious problem. 82% said that the cost of housing was an extremely or very serious problem. And 79% said that homelessness was an extremely or very serious problem. So like I said, we ask about all different types of things. And this was really, this is always one of the first questions that we ask folks for them to rank and tell us what they think is the most serious problem in Colorado. Now, when you break it down by race and ethnicity, you can see that different racial and ethnic groups really offered a lot of the similar rankings as Coloradans overall. For Native and Indigenous folks, the cost of housing was number one at 98%, said that it was an extremely or very serious problem. Homelessness, you'll see gun violence, the cost of living. Most of all of these things aligned with other racial and ethnic groups. Another question that we asked is whether or not you or someone you know has been treated unfairly in certain situations. This one has to do with interacting with law enforcement. So 29% of all Coloradans said that they or someone they knew had experienced or had been treated unfairly when interacting with law enforcement because of their race and ethnicity. But when you break it down by race and ethnicity, Native American and Indigenous folks overwhelmingly said that this was a serious problem, 59%. Now I'm just going to go through a few sections of some of the key findings, and I'll make sure to highlight where Native American and Indigenous respondents either stood out or how they differ from other racial or ethnic groups. So the first is on perceptions of state government effectiveness. Now this was a set of questions that we asked for the first time this year, really to just get a sense of how are people experiencing government overall? Do they feel like it's working for them? do they feel like their voice is being heard? So this question is, overall, how satisfied are you with state government in Colorado and how well it works for people like you? Overall, Coloradans were 52% satisfied, 45% were dissatisfied. And you can see the breakdown by race and ethnicity. A few things change. Really what we noticed, particularly with this question, depending on your political affiliation and who happens to be in charge of the state government, that's really what changed the most. But 50% of Native American and Indigenous respondents said that they were satisfied, compared to 40% were dissatisfied. More than a quarter of all Coloradans said that they or someone they know has been treated unfairly because of their race or ethnicity when interacting with government agencies. That skyrockets up to 63% for Native American and Indigenous Coloradans. And you'll see we also asked about, why did they think, like, what were some of the potential challenges that could keep Coloradans like them from being heard in state government? So we listed a few potential challenges. You'll see that Black, Latino, and Native American Coloradans are more likely to say that the lack of information about how to engage with state government is a major challenge. So you'll see other opinions were the strong influence of lobbyists and corporate interests, limited understanding among state policymakers about the needs or concerns of Coloradans like you. And you'll see that really these are aligned when you break down by race and ethnicity, but there are a few things that stand out. Respondents of all racial and ethnic backgrounds ranked these potential actions about how we can possibly improve how policy decisions are made in state government. Things like requiring state policymakers to consider the long-term financial impacts of their decisions, requiring state policymakers to regularly engage with and listen to Coloradans like you in a meaningful way, or requiring state policymakers to consider how their decisions will impact different groups. Again, most of these reflect Colorado as a whole. The next section is the cost of living. So this was another thing that we wanted to highlight. This is all respondents. So approximately half of Coloradans say that they are living comfortably, while nearly 2 in 5 are really struggling or just getting by financially. Breaking it down by race and ethnicity, a majority of Native Americans and Indigenous Coloradans say that they are really struggling or just getting by. So you'll see that over 50% say that, compared to other racial and ethnic groups. And Native American Coloradans are increasingly indicating to us that they are worse off financially compared to previous years. So you'll see this is a question, would you say you are better off or worse off financially than you were a year ago, or are you about the same? Compared to 2021, 28% said that they were better off, compared to only 15% this year who said that they were better off, and 55% said that they were worse off, either somewhat worse or much worse. We also asked questions about their employment status. So we asked, do you plan to be employed over the next year? And if so, how worried argue that you may not be employed over the next year. So a majority of Native American respondents luckily are not worried about losing their employment status in the coming year. So 57% said that they were not worried, 28% said that they were worried, which is slightly higher compared to all Coloradans with 21%. We asked about whether folks were worried about affording food. More than 1/3 of all Coloradans are worried about affording food in the next year. Latinos, Native Americans, and those living in with low income under 50,000 a year are especially concerned about food insecurity. And we also asked, not only are you worried about affording food, but have you actually, how has that truly affected you? Have you skipped any meals because you couldn't afford food? And 35%, more than a third of Native American respondents said that they have skipped meals because they couldn't afford food. We also asked certain policy questions, policy solutions that could be used to address the rising cost of living. Native American and Indigenous Coloradans did respond fairly similar to other racial and ethnic groups. Things like making it easier for low-income folks to enroll in programs that help them afford the cost of household expenses, increasing the amount of tax credits available, making government investments to stimulate the economy and create better paying jobs, as well as raising taxes on people making over $500,000 per year to cover services like housing or healthcare or education. Getting more into the cost of housing as well as affordable housing, unemployed Coloradans, people of color, and renters were more likely to worry about losing their home in the next year. When it came to Native American and Indigenous respondents, 49% said that they were worried that they may lose their home because they couldn't afford their monthly rent or mortgage, compared to only 28% of Coloradans as a whole. You can see that this has kind of changed year over year. It did decrease from last year when we asked this question. 58% in 2022 said that they were worried that they wouldn't be able to afford their rent or mortgage, compared to 49%. That is a 9% difference. Not super great, but it is a decrease. Native Americans and Indigenous respondents were also more likely to report working multiple jobs in order to afford their housing. So we asked, have you done any of the following? Either worked multiple jobs or more than you wanted to, if you moved because you couldn't afford your rent or mortgage, or if you've lived with a roommate or a friend or family member when you'd rather not. 50% of Native American and Indigenous respondents said that they've worked multiple jobs or more than they've wanted to in order to afford their rent or mortgage. Nearly 1/4 say that they were treated unfairly when they were trying to either rent or purchase a home because of their race or ethnicity. So that was nearly 1/4 of all respondents. When you look by race and ethnicity, though, Native American and Indigenous respondents overwhelmingly said 63% said that they have been treated unfairly when they were been trying to rent or purchase a home. Additionally, we asked other policy actions that could be used to address some of these issues with housing. and respondents of all races and ethnicities ranked similar effectiveness of these housing policy actions. Things like reducing property taxes for homeowners living on low or fixed incomes. You'll see that we all went through a statewide election with Prop HH, ensuring landlords cannot raise rent on current tenants too quickly, changing zoning laws, or requiring developers to build more housing for people on lower incomes. We also asked many questions about healthcare and mental health. Black, Latino, and Native American Coloradans are the most worried about being with health insurance in the next year. 69% said that they were worried about not having health insurance in the next year. That's compared to only 37% of Coloradans as a whole. And you'll also see folks who are living on lower incomes, 64% of folks who make less than $30,000 a year were worried about not having health insurance. Coloradans of color are also more likely to say that they or someone they know had been treated unfairly when seeking healthcare services. Looking at race and ethnicity, Native Americans were overwhelmingly, again, more likely to say that they had been treated unfairly or someone they know had been treated unfairly because of their race or ethnicity. 3 in 5 Native American and Indigenous Coloradans said that they had postponed medical or dental care in the last year. They were the most significant group that said that they had postponed medical or dental care. You'll see 62% said that, 59% of Coloradans with a disability said that they had postponed, and folks living on lower incomes said that they were most likely to postpone medical or dental care. Another question that we've asked year over year is, in the last year, have you experienced mental health strain? These are things like anxiety, depression, loneliness, or stress. And Native Americans, 85% said that they had experienced some type of mental health strain. This is compared to 57% of Coloradans as a whole. They were the second most likely group to say that they had experienced some sort of mental health strain. We asked plenty or additional questions about how we can possibly address things to improve mental health. Native American respondents said that making it easier for folks to receive mental health screenings and services at the same places that they receive other physical health care. 93% said that that would be a very or somewhat effective approach. Other things were pairing mental health professionals with law enforcement and increasing government investments in programs outside of healthcare settings that seek to prevent mental health and substance use issues. So though that is the data, and I'm going to bring it back to our reflection questions. So as I know that I went through all of that data, I know there's a lot of numbers, I know that it's a lot to kind of take in, but as we went through this data, I want you to think about, how can we ensure that we're getting the information from folks that represent this community? How can we make this data more useful for you and your organization? And, how you would like to be engaged with this, with Pulse and the poll overall in 2024. So with that, I'm going to open it up to questions. You can ask me about the data, add any comments, but really I want this to be a chance for us to have a conversation. So feel free to just come off mute and we can get this started. Does anybody have questions about, either particular findings or, what we plan to do with this information?
This is Lucille Echo Hawk. Can you hear me?
Yes. Hi, Lucille. How are you?
I'm pretty good. Thank you. I'm here on behalf of the Denver Indian Family Resource Center and also the Native American Housing Circle. And I wonder if, I know you do this yearly, and thank goodness that you do. And it is helpful information, but what's even more helpful is if we can begin to drill down into specifics with the folks who are responding. Is that at all a possibility?
Yes, so I will be sending out the top lines as well as crosstabs. So you are able to kind of dig in and see a little bit more about, how Native American respondents who also identify as LGBTQ or who have a disability or live in a particular region. Now, I will say, because of the sample size, and because of how many folks may identify in multiple ways, that we're a little less confident that that is representative of everybody who has those same identities. But we are able to dig in on each question on those Native responses. And we also have our interactive dashboard so that you can kind of play with that data yourself in an easy way. And so that you don't necessarily have to go through pages and pages of spreadsheets.
Thank you.
Absolutely. And thank you all again. I know a lot of folks on this call did help with getting this information out to your networks, as well as just getting out the convenient sample poll. So thank you all again. Carly has a question. Are we able to look at rural versus metro? Yeah, so we can kind of break the data into rural versus Denver metro. Like I said, we do break it out into the Eastern Plains, Western Slope, and Larimer and Weld counties as well. Any other additional questions, thoughts? This is open to everyone.
Hi, this is Jen Russell. I represent both the chair of the board of directors for Denver Indian Health and Family Services, and I'm also a research instructor at the Centers for American Indian and Alaska Native Health, member of the Choctaw Nation of Oklahoma. I just had a question. I was able to meet with the National Caucus of Native American Legislators yesterday, and they had a really big interest in the data that's coming out of specific things like this. So I'm just wondering if you all are sharing these things with them, sharing things with that group specifically on how they might, create specific legislation that can help with some of these issues.
Yeah, that's great to hear. I don't believe that we've been connected with them, but I would love any opportunity if you have the chance to make that connection, either an email intro or anything. But absolutely, this information is open to anybody who is willing to listen and use it. So I'd love to get that into their hands.
Yeah, I can absolutely share the contact information for the woman here in Colorado that we worked with, who is responsible for coordinating the entire caucus. And, like I said, they just had a real interest in gathering this data because they don't feel like it's, readily available in one certain place for them, not just this data, but any data that comes out of specific research that has been gathered, that we can really show the outcomes that can make an impact in, you know, in our communities. So I will share that information with you, and hopefully you all can then pass this along to them.
Yeah, that would be great. Thank you so much for that. That
Yeah.
would be amazing. Else? Questions, concerns, any thoughts on those reflection questions? Okay. Well, I don't want to keep you here any longer than you need to be. I will share one more slide. I did mention that all of this information is completely available to the public, and that you're able to kind of play with the data yourself. So if you go to our website at copulsepoll.org/results, you'll see that we have this interactive data dashboard. You can play around, see what the responses were for different groups, whether that's Native American or that is, you know, certain income levels. You can see how they match to the rest of Coloradans as a whole. And then finally, I will just include my contact information. Please feel free to reach out to me at any time. And I thank you again for joining me on this Friday, and I hope you all have a wonderful day. Thank you.
Thank you.
Thank you. Thank you.